Okay, guys, so we're looking at a cross syndrome. All right, so this is what is known as the Pearson syndrome or the Pearson bone marrow pancreas syndrome. So it's a type of disease condition that will affect your bone marrow, that's exocrine function, that's the production of all those enzymes like what? Lipase, protease, amylase, all of them will be affected. You understand? They also go to affect your bone too. Alright. So Pearson syndrome is also known as what? Bone marrow pancreas syndrome. Okay, so Pearson marrow pancreas. This is Pearson bone marrow pancreas syndrome. Right. So it's actually a rare mitochondrial disorder that primarily affects your bone marrow and the pancreas. Alright. So pancreas is affected, bone marrow is affected. So bone marrow impact, it will now affect all those hematopoietic stem cells in your bone, right? So red blood cells will be produced small, that's anemia. White blood cells will be produced small, that's neutropenia. Platelets will be small, that's thrombocytopenia. So symptoms just include fatigue, frequent infections, easy bruising, prolonged bleeding. Alright. So pancreatic impact. Pancreas is also affected. So basically, it's the enzymes of the pancreas that will be affected, right? So you know these enzymes are meant to digest food. So because the enzymes are affected, you have problems digesting food. Then diabetes is due to insufficient insulin production, so high glucose levels in the body. So symptoms include frequent diarrhea, stomach pain, trouble gaining weight. Okay, trouble gaining weight. Well, then diabetes, right? So other symptoms, it can also affect other organs like the liver, the kidneys, the eyes, the ears, right? Then some individuals may experience lactic acidosis, which is buildup of lactic acid in the body, right? Genetic causes is usually caused by what? Deletions in the mitochondrial DNA, which affect the cell's ability to produce energy. So most cases just occur spontaneously, or sometimes you inherit it, right? So I think that's it for the piercing bone marrow pancreas syndrome, where the bone marrow and the pancreas are affected. So on the age of the tissues, you know the symptoms and all of that. Okay, so that's it.